So I had a very humbling experience in the gym / with physical therapy the last, about 2 weeks ago. And I wanted to share it because I think it provides some valuable lessons for those of you who are suffering from chronic pain and are trying to exercise or wanting to exercise and are just struggling with it. So I've been dealing with a little bit of a left shoulder issue, probably on and off now for close to a year, getting some imaging on it, but we've just, based on history and physical, just suspect that I have most likely a posterior labral tear. But because we're going to be doing some more advanced things, we're just going to get some imaging on it. And working with a really, really great physical therapist, and we've been obviously working around this, working through this, and programming to strengthen the shoulder, which has helped a ton. But one of the really, really crucial things that we had an aha moment with, or more so that I had a moment with, is that I have not been activating my serratus anterior very well. So serratus anterior is this muscle that's kind of on the side. It is on the ribs, and then it's going to come up to the scapula. And one of its main jobs is to keep the scapula pressed up against the ribs through its range of motion. And we were going through an exercise that was painful for me. And this is also the sign of a good physical therapist, is when we do actual physical therapy and I see him, we don't just do passive therapies and stuff like that. He goes, okay, what activities from, the programming that you've been doing, the stuff you are doing in the gym on your own, what activities are most aggravating to you? Let's go through that pattern to see if there's some breakdown in the pattern, to see if it's just the tissues being overloaded and we need to adjust, or are my movement mechanics bad? And one of the things that came up was on some presses is that I was not activating my serratus anterior well. And he goes, hey, show me those serratus, the band exercises that I've been having you do, because one of them is supposed to be helping to activate serratus anterior and to strengthen it. And it's essentially where you've got kind of two bands. I only have one arm here because I'm holding the camera with the other arm, but you got bands, you pull them apart, and then from here you're actually coming, let's see if I can get this, you're coming upwards with the elbow while you've got a band in between both wrists, and you're doing this to basically do a forward elevation while against an external rotation resistance. And so I show him that, and he goes, dude, you're not activating your serratus. I want you to do this. And he cued me, and how he cued me is actually really important. And another good sign of a good physical therapist, he didn't say, activate your serratus more, or he didn't poke at the muscle and say, activate this more and just try to poke at it, because that doesn't compute with most people. I have been an athlete for a very long time, and at certain points at a very high level. And I have a degree in kinesiology. I do this stuff for a living, and even sometimes it is difficult if you just poke at a muscle and say, activate this. That's just not how this mind-muscle connection is going to initially work. And so he says, hey, I want you to, when you do this movement, I want you to take your elbows, and instead of just coming upwards like an uppercut, I want you to take your elbows and almost do like a U-shaped pattern where it comes, the elbow, instead of just coming up like this, is now coming more outwards like this and then up. And holy cow, I think for the first time in my life, I activated serratus anterior. Not joking. So I go and I implement that in my exercise, in the program that I'm doing in the gym on my own. And the first workout I did, I actually had to drop weights because I was not used to actually being in a position where my scapula was properly positioned. And so because of that, the muscle patterns that I have are not ingrained, so it's actually a little bit weaker. However, my shoulders felt better. Did a whole workout that normally would kind of aggravate, if my baseline shoulder pain was a 1 out of 10, after this type of exercise, it might be a 3 out of 10. I was a 1 out of 10, and I stayed a 1 out of 10 the whole time. And it's not because I dropped weight, because I have tested that out before where I've done the same workouts and dropped weight and I'm still aggravated. Might be a 2 out of 10, sometimes it's still a 3 out of 10, but it's not the fact that I did less weight. It's the fact that I was actually in a better position with my scapula, and so now I was moving better, and I was not placing improper loads through different tissues, and I was not poking the bear. I was not aggravating it. So I texted him jokingly saying, pretty sure that's the first workout I've ever done where I was in a properly positioned scapula for the duration of the workout. Now, my background is in track and field, and not the field part, more so the track part. I was a sprinter / quasi middle distance, wannabe middle distance runner. And so lower body wise, is where a lot of focus has been on over the years. And this was obviously an upper body exercise. So maybe that's part of the reason why I was never properly cued on how to activate serratus anterior and have a properly positioned scapula for these movements. Anyways, what I'm getting at here is that even with all of my knowledge, all of my expertise, all of my training, everything that I have, if even someone like me is going to struggle sometimes with getting the proper positioning and requires a physical therapist, a good one, to help get you into that position, then that means that other people are going to need that as well. And now I've done physical therapy before. I've maybe seen probably about 4 or 5 different physical therapists over the years, and not once has this ever been caught. And I'm not saying the current PT I'm working with is perfect. I'm sure there's things that are not getting caught with that. And in several years, I might find something else out. Obviously, that is possible. But the point here is that we have to be open to doing new things in physical therapy in order to learn new things about movement patterns about ourselves. And you also have to make sure that you're working with a good physical therapist. That is difficult for you, the person in chronic pain, because you don't have a way to know, is this physical therapist good or not? And so you're really relying on just videos like this to learn what makes a good physical therapist. You know, obviously Yelp reviews and Google reviews, I don't know if anyone actually uses Yelp anymore, Facebook reviews, all those things are fantastic. However, what I really want to stress here for good physical therapists is that when they are working with you, they are trying to cue you in order to help get you into better positions, and they're trying to see if they can actually reduce your pain with movement activities. The best thing you want is a physical therapist who is going to change your movement pattern such that a movement pattern is now better and therefore less painful or not painful, as opposed to saying, all right, we're just not going to do that. So in my example, if I had a physical therapist who said, all right, we're just not going to shoulder press anymore because it hurts you, that is not a good physical therapist. Now, that may be appropriate at times for some people, but in my situation, that would not be appropriate. In my situation, what's appropriate is let's get you actually moving better such that you're not continually beating the crap out of tissues, and that's why you're oversensitized and having pain in the shoulder. So good learning lesson here, and I hope y'all take something from this. See ya.